Okay guys, and welcome back to the channel. So today we're going to do a question answer, a quick Q&A that I put out on Facebook earlier this week. So I've asked you to send some questions to me and I can hopefully answer them to the best of my ability. Okay, so I've got some questions loaded here. Some people inboxed me them. So if you inbox me them, I will keep your name private just because maybe you didn't want people to hear your question or know you've asked it, which is fine. And then the ones that were commented, then I'll give you a little shout out. So the first one is from somebody who inboxed me. And he said, "Hi Rowan, been watching your videos online. I prolapsed a disc in my back 12 months ago. I'm back at the gym now, but I train with my friends who train heavier weights than me and are stronger than me. When I try to keep up with them in the gym, it hurts my back a lot. What should I do?" Right, so I think you could probably answer your own question in this one. I would personally not train with those boys or do the same routines as them. No reason you can't go to the gym the same time as them, go in the same cars as them, share a lift with them, go in the sauna after with them. But at the moment, if they're stronger than you, they're doing different sets than you, they're doing different weights than you, I would very, very much advise you to do your own thing at the gym, even for a short period of time. You can work on your strength, work on your routines, and get yourself into a comfortable and safe place, and then train with them maybe further down the line when you're in a position to do so. So I feel like you could probably answer that one yourself, mate, if we're being honest. Stick to your own routine, still go with them, but do your own thing in the gym until you're capable of keeping it up. Otherwise, you're just going to hurt yourself and you're going to go backwards. Okay. So the second one then is Jenna Richards. Best remedies to fix posture. I find I arch my back an awful lot. So a couple of things here, Jen. Recently, there's been a lot of stuff, well, the last couple of years, surrounding posture. It's quite a hotly debated topic within the chiropractic, physio, osteopathy world. Is posture good? Is it bad? But there's quite a bit of stuff saying now, Jen, that posture can actually be protective for you. So everyone's different. Everyone's going to be taller, shorter, bigger, wider framed, different sizes, different widths. Okay, so posture shouldn't be exactly the same for everyone. And actually, even if you have got a little bit of an arched back, that might be suiting to you. And your way of standing or sitting or at work might even protect your back a little bit more than if you tried to maintain a perfect posture or one that you think might be perfect but may not actually suit you. So I would say probably don't beat yourself up too much about having a slight arch in your back. Obviously, if you're really, really super arched, it's not going to be good. But I would say maybe don't stress too much, as especially being female with the research, your posture is probably protecting you more than you think. Okay. So the next one then follows on. Holly Bennett. The above message has prompted me to think of one too. I've seen posture correctors advertised for people who work at desks. Do they work? I've worked at a desk since my first job at 17, and I am probably beyond help. Probably not beyond help, Paul. There's hope yet, honestly. With the posture correctors, there's one that I'm going to be reviewing quite soon. The perfect posture kit. Now, I've had one of these for a long time. This is a new one that I've been sent by a chiropractor called Mike Cassidy-Hogg, and his wife is a physio. So a really nice guy. Spoken to Mike a few times over the years, and he sent me this posture kit. I've already got one, okay, but it's been through the mill. I've used it a lot. So in the kit, and the reason I like this kit in particular, in answer to Holly's question to Holly, yes, they can help. I like this one off Mike because it comes with a posture corrector, which I will review in the coming weeks, probably about a month's time. Comes with the actual posture corrector, comes with a TheraBand, and then it also comes with a massager or a peanut ball. Now, the reason I like this so much from Mike and his wife is that it doesn't just give you the kit or the posture corrector, put it on and leave it. There's actually things to work on that they've researched regarding doing some work in the mid-back with a peanut massager and doing some work on your rhomboids and your posterior back, as well as using the actual corrector itself. So I think it's really good. Yeah, and it's been backed by two of them, a chiropractor and a physio working together. What more could you ask for? Great. However, there are other ones on the market that are good, Hal. I've only ever really used that one because it was sent to me 6-7 years ago and I quite like it. So they are good, most certainly are useful. So yeah, I would say if you want that one, I'll put the link in the description. Posture correctors can be beneficial, just don't overuse them. And that leads us right into the next question from Savannah, which is, can you tell us a little bit more, Ro, about posture correctors? Can they be damaging if you use them too much? And can they cause muscles to become weaker? So there's quite a lot of variation on different products and different posture correctors. They're all going to do roughly the same thing. It's different positions they sit on in your chest and back, but essentially going to pull your shoulders backwards, or get you to pull your shoulders backwards and then tighten in position. Now, the one that I use, the Perfect Posture, that recommends using it for 30 minutes a day to start with when you first start, and then you can build up slightly. Some of the ones I've looked at have said you can use them up to sort of 4, 5, 6 hours a day. My personal professional view is that would be way too much. Something like this, in my opinion, and that's all it is my opinion, is something to help remind your body or help tease your body into a certain trend, posture, whatever way you want to talk about it or look at it. So I would say using these sparingly, 30 minutes to an hour, a few times a day maximum would be all that I would do, and would be all that I would recommend to my patients to do. Obviously, other people are suggesting different things, and that's absolutely fine. But I wouldn't see myself ever keeping one of these on for longer than, personally, me, 30 minutes-ish, but up to an hour, a couple of times a day. Remember, it's just to try and help you get into a position with the other stuff like the massager and the band, and the same with the other ones, rather than keeping it on all day. Because if you keep it on all day, it's going to be maintaining certain positions for you, and then that could lead, in my opinion, to some issues further down the line. So yeah, Sav, good question. Don't wear them too much, I would suggest. Okay. So then there's another one. Not related to any physical issues. However, what made you choose the field you were working in today? Good question. I always wanted to do something medical with patients, whether it was nursing, a doctor, or something along those lines, a radiologist, a physiotherapist. That was always the avenue I really wanted to do when I was 15, 16. When we had to choose our options and sort of decide which route you wanted to go down, I started to look into it a bit more deeply. I stumbled across an article when I was sitting in Cardiff Airport ready to go on a family holiday, just advertising the chiropractic course in Pontypridd. I saw it, it sort of sparked something in me. I looked into it when we were on holidays, and I decided that's what I wanted to do, applied for the course, got accepted, and the rest is history. So I always knew I wanted to do something with patients. But chiropractic then just appealed to me when I started looking into my options. That's a really good question. Lisa, is it still safe for an individual to visit a chiropractor if they have made them aware they suffer with osteoporosis? So the short answer here, Lisa, is yes. Like, I can't speak for every chiropractor that's out there. However, what I can speak for is chiropractors in my area, Neath, Talbot, Swansea. I know most of them very well, all excellent, I must add. And I taught in the university for just a shade under 10 years. And the education that the chiropractors coming out are getting on patient care, osteoporosis, the risks of such, how to manage it, is very, very high. So although I can't speak for every chiropractor, I would say that most chiropractors, if not an exceptionally large amount, would be absolutely equipped to deal with you with osteoporosis. They would know how to look for it, even if you hadn't told them. And if you have told them, that's even better. They know how to screen for it, and they would definitely have lots of different treatment options to still get your results while not taking any risks. So overall, osteoporosis is not a reason not to attend. Many, many techniques chiropractors use that can be tailored for you. Okay, Lisa, hope that helps. We have got... So on the messages from a lady, I've not long started training weights for about 6 months. I'm really enjoying. However, I did have a traumatic injury to my disc back in May of last year. The training is helping me a lot. However, I'm afraid that I'm going to put on too much muscle while I'm training weights. Will that be negative for my back? One. And will I get too muscly too? Right, quite a lot to unpack there. So I would say if you're enjoying doing weights and that's what you want to do, you shouldn't do anything you don't want to do. But if you're enjoying your weights, I would keep doing them. All right. Having a good amount of lean muscle mass is going to be protective for you, your back. It's going to be good for your overall health, especially as a female. I'm not quite sure how old you are, but especially as you get older as ladies, training, doing resistance training, lifting weights, using your skeleton and maintaining or even trying to gain a little bit of muscle mass is massively beneficial, not just for your spine and your back and joint health, but for overall health. So that's super important. Please keep doing it if you're enjoying it and that's what you want to do. On the second point, you talk about, will I get too muscly? I don't know, depends what you're doing. But I personally wouldn't worry about getting too muscly. It's extremely difficult to actually put on lean muscle mass. People try for years and years and years to get big, to put on size. It's not an easy thing to do. I'm imagining by what you've written here that you've just started training or newish to weight training. So initially, you will get quite a lot more gains because you're doing something new. There's a new stimulus going into your muscles, your tissues, your body. Okay, so you will see normally quicker gains muscle mass wise and gym wise and weight wise and increase wise when you start training. That will peter off, I'm sorry to tell you. So you won't keep gaining muscle mass at an exponential rate. That will level off a little bit. It'll probably be very difficult. You'd have to be super strict with your training, with your diet, getting good sleep. There's going to be a lot of factors that'll have to align for you to gain a significant amount of muscle mass for it to be too much. It does depend what you want to do at the gym, how you want to look. But I would say you're probably, if you train really, really hard for the next few years, when you start to peter off after your initial gains, you'll probably gain a lot less muscle mass than you think you will. So if you're happy and you're enjoying your weights, I would still keep training as if you're trying to gain muscle mass. Do train to failure and try and have that aim, because you're probably just going to have quite an athletic, strong, durable physique rather than actually getting too muscly. So that's what I would do if I were you. I hope that helps. So keep training, keep moving, and try and keep and gain a little bit of muscle mass. It'll be really good for you. Okay. So we've got two more in this week's. Is there anything that particularly frustrates you? Oof, how long have we got? Yeah. When they put those orange flavour chocolates in the roses, that really frustrates me because I don't know who would eat those. They're horrible. And then last one, Ian Fallon, herniated disc issues. Do you recommend a chiropractor, adjustments, belt supports, cushions, etc., etc.? Thank you, Ian. Okay, Ian. All of the above, potentially none of the above. So herniated disc issues, which I've suffered with myself, I've had terrible trouble over the last 15, 16 years periodically with my back. So I hope you're okay. I know what it's like, and it's not fun at all. There is no one size fits all, Ian, unfortunately. It's such a massive, massive spectrum of symptoms you can have. How you are as a person, how you perceive pain, the injury you've had, if it even was an injury, what your day-to-day role is, all of these things, what your training's like. There's a plethora of things that will factor in to how your particular disc issue presents, okay? So unfortunately, I'd love to be able to say to you, yes, get adjusted. That's the right thing to do, or don't do that, or yes, wear a belt support. I do all of these things with all of my patients and much, 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 much more. But sometimes I'll pick ones out and take things out. I don't do everything the same with every patient. And that leads us back into, do you recommend a chiropractor? I recommend a chiropractor, yes. I recommend just a very skilled, knowledgeable physician, full stop. So I'm not here to purely promote chiropractors. I think it's an amazing profession, and I think we're extremely skilled and deal with stuff like this excellently all the time. But you might have an excellent physiotherapist, osteopath. That's also absolutely fine. I would say get somebody on board who is one of the above, who is knowledgeable, is skilled, is passionate about what they do, because they then will be able to work with you and guide you through all those things. Should you have adjustments? There's many different reasons of why you may or may not adjust someone when they've got a disc issue. How old it is, the type it is, where it is. There's so many things that it isn't just a yes, no. The belt supports, I personally like recommending those to patients. for certain activities, especially sort of weighted stuff. Cushions, I'm actually reviewing loads coming up on the channel. It'll probably be a little while longer, and I've got a whole chapter based around sleep, which I'm really excited about. But yeah, absolutely you should. Unfortunately though, I can't just give you, do this, buy this cushion, use that belt, because I don't quite know your circumstances. So I would say chiropractor, yes, or skilled physician who knows what they're doing. Treatment instead of adjustments, so that might include adjustments 100%. So get treated, and then those professionals will be able to guide you through then maybe the best way to navigate what treatment to do with you, what supports you need, what cushions you need, what sleeping posture you need, morning routines, gym routines, and all those things. So that would be my advice to you, and if I was to give you any. Okay, so that's us for today. I hope that was enlightening a little bit. We're going to do a few more of these because I've got loads more questions, but I wanted to keep it short and sweet today. So thank you for watching. Hope my answers have helped you even a little bit.